Well, what about non-uniform? Non-uniform is typically diaphragmatic hernia, cystic adenomatoid malformation, or some other chest mass. Mean airway pressure equal to or maybe 1 or 2 centimeters of water greater than conventional. It really depends on the normal lung. If the normal lung is not normal, meaning it's a preemie who has RDS, then you're going to have to use more mean pressure. Otherwise, you can get by with a mean that's just 1 or 2 greater than conventional. From a frequency standpoint, 8 to 10 hertz for these patients. We typically would not go higher than that. And you don't want a big chest wall movement, you want small chest wall movement because you're trying to be lung protective. And here's a baby with a diaphragmatic hernia, left-sided, and you notice the right lung is probably a little more inflated than needed. I like the diaphragm to be a little bit closer to the heart border because the baby doesn't need to be quite that inflated. But you can't count ribs at 9 ribs because at 9 ribs, the right lung will not be adequately inflated. And so what you really have to look at is where is the diaphragm and where is the right heart border, and do I have lung over the upper part that's adequately inflated? And in this case, the rest of the lung looks good, but you probably could come down a little bit on the mean airway pressure. The key for using high frequency is to achieve appropriate lung expansion. You want the lung to get uniformly inflated because if you are going to adequately ventilate the patient, the lung has to be open because that's how gas is exchanged, because you don't make big changes in the airways like you might with a conventional ventilator. And if you get overdistended, as this X-ray shows, that will be lung injurious and that will worsen pulmonary hypertension. So avoiding lung overinflation is as important as avoiding lung underinflation. And again, since your oxygen, because you've worsened pulmonary hypertension, will be lower, people make the mistake and increase the mean airway pressure trying to improve oxygen and cause, as happened in this baby, an air leak. As you can see, the chest tube on the right. So one wants to be very careful. And obviously, if you examine this baby, the liver will be down, well below the costal margin. And if that's the case, you should always think the baby may be overinflated rather than underinflated. And on the other hand, you have this baby whose lung is white, has air bronchograms, who clearly is inadequately inflated. But if you count ribs, ribs are right about 9 ribs. And so some people say, well, he's 9 ribs, that's okay. Well, the answer is it's not okay because this patient is inadequately inflated and needs a higher mean to get the lung inflated. Once inflated, you should be able to back off on the mean airway pressure. And again, we go back to the baby with pulmonary hypoplasia. If you say, well, gee, this baby's right now about 8 ribs, and that's underinflated for most people because we use 9 to 9.5 ribs. So you must look at the lung disease. Look at these lungs. These lungs are clear. What that means is the lungs are small. So if you push this to get to 9 ribs, you would probably create an air leak and injure the lung because they're small and fragile. So you can't just count ribs. You have to look at the parenchyma of the lung. In this case, the parenchyma of the lung looks good. You don't need a higher mean. In the previous one, you had adequate rib counting, but the lungs are white, so you need a higher mean to get the lung open. And here's a baby who's reasonably inflated but has a lot of patchy disease. And this baby needs more amplitude, better achieved by either a lower frequency or more amplitude to open up these atelectatic areas, because if you just turn the mean up to open them up, then you will overdistend the more normal parts of the lung and potentially injure them. So, high-frequency ventilation is a very useful technique to treat specific lung diseases. However, one must remember that the strategies for the different lung diseases are different. And if you have a disorder that may air trap, you have to use lower frequencies. And if you just have diffuse alveolar disease, you can get by with higher frequencies. But the key is to get the lung uniformly inflated, which you will know by being on a lower FiO2, and then wean it when you need to, because over time, on the same mean, the lung will become more and more inflated as compliance improves, and therefore you regularly have to reassess the baby and decrease the mean as indicated.